Lesson from Korean COVID-19 experiences. Realistic diagnostic guideline for worldwide pandemic situation. Part 1. Understanding SARS-CoV-2 virus and 3 different methods for COVID-19 diagnosis. COVID-19 is caused by SARS-CoV-2 virus. This virus is composed of gene and antigen. First, you can detect the genes when the virus infects through nose or throat. Virus genes can be detected by RT-PCR method. Second, antigen can be detected from human oropharyngeal, nasopharyngeal specimens and sputum specimens. This antigen can be detected by FIA Rapid Antigen Kit. 10 days after virus infection, antibodies can be detected in blood. IgM or IgG antibodies can be detected by Gold Rapid Kit or Total Antibody ELISA Kit. PCL is providing all 3 solutions from RT-PCR, antigen to antibody detection kit. PCL's one-step RT-PCR kit contains highly sensitive N gene and showed 7 to 43-fold higher sensitivity than other RT-PCR kits. PCL Antigen Rapid Kit is a dual antibody sandwich reaction with fluorescence immunochromatographic assay to detect N antigen of SARS-CoV-2 in 10 minutes. PCL's antigen rapid test can detect below 1,000 copies of virus, whereas RT-PCR kit can detect below 100 copies of virus. PCL's antibody rapid gold can detect IgG and IgM antibodies of N and spike protein of SARS-CoV-2 in human serum, plasma, venous blood, and capillary blood. After seroconversion, PCL's antibody kit's clinical sensitivity is 90.76% and clinical specificity is 99.35%. Lastly, PCL is providing Total Antibody ELISA Kit for massive screening of blood samples. PCL provides antigen sandwich method for detecting total antibodies from IgG, IgM, and IgA. Part 2. Preventive total solution for COVID-19 pandemic situation. The first confirmed COVID-19 patients in South Korea, January 20th, were those who came from or had visited China. Lately, secondary and tertiary spread occurred, and the speed of transmission accelerated. By May 1st, in some 180 countries and territories, representing every corner of the globe, have now reported at least 1 case of the novel coronavirus. In total, there are now over 3 million confirmed cases and over 215,000 related deaths. Transmission of COVID-19 can occur early in the course of infection, since SARS-CoV-2 viral loads in asymptomatic patients are similar to those in the symptomatic patients. This indicates asymptomatic or minimally symptomatic patients with low levels of detectable viral RNA can transmit COVID-19. Therefore, a total solution is needed to detect the virus in the early phases of infection to prevent secondary or tertiary spread. Part 3. PCL is providing total solution for COVID-19 diagnosis. Antigen kit recommendation. First of all, PCL recommends antigen kit as the first barrier for COVID-19 prevention. Antigen detection is a quick 10-minute assay with high sensitivity. It can sort positive patients quickly. If the antigen test result is positive, confirm the patient as a positive case. If the antigen test result is negative or the patient displays symptoms, perform the RT-PCR. RT-PCR is currently the only way for confirming COVID-19 infections. However, it requires 3 steps along with professional equipment and technicians. Throughput is not good, and it takes more than 6 hours to obtain the results. After using antigen test, we can reduce the burden of RT-PCR assay and sort patients as early as possible. However, antigen assay is less sensitive than RT-PCR by nature because antigens cannot be amplified like RT-PCR methods. We usually assume that RT-PCR CT value that is lower than 30 can be detected from antigen assay. Antibody recommendation. The antibody method is very useful in finding antibodies in the blood at least 10 days after infection. PCL's Antibody Rapid Gold detects IgG and IgM antibodies of COVID-19 infection from fingerstick of blood in 10 minutes. Antibody only appears 10 days after infection. Antibody kit can be used to complement the RT-PCR or antigen assay for COVID-19 patients. In addition, we can use antibody method to determine when COVID-19 patients can return to work or school. Multiplex IVD Leader, PCL.